Did you know over 90 million people in the United States snore? It's estimated up to 52 million people in the United States have obstructive sleep apnea, yet only 10% of cases are actually diagnosed. Obstructive sleep apnea can lead to cardiovascular disease, dementia, diabetes, even sudden death. Just like with our oral cancer screening, this screening could save somebody's life. In 2017, the American Dental Association updated their policy to include screening for obstructive sleep apnea into our exams. That's why we're here today. So during our oral cancer screening, we're also going to check for signs of an obstructed airway. We're going to start by looking extraorally. So we're going to start by checking the patient's neck size. The patient's neck size for a male is over 17 inches, or for a female over 16.5 inches. That could be a sign of an obstructed airway. We're also going to check for a narrow jawline and for a class 2 facial profile. Those can also be signs of obstructed airways. Then we're going to look inside of the mouth. We're going to start by checking for any inflammation on the anterior region, which could be a sign of mouth breathing. We're also then going to check for signs of bruxism. Bruxism can either be sleep bruxism, but it could also be a defense mechanism for obstructive sleep apnea. So we're going to start by checking the hard tissue. So along the teeth and the gum lines, we're looking for any areas of abfraction lesions. That could be a sign of clenching or bruxism of the teeth together. We're then going to check for any exostoses on the outside of the teeth. We're going to check for any tori on the inside. We're also going to check for a tori on the maxillary. While we're there, we're going to check the palate, a very high palate. That can be a sign that the floor of the nasal cavity is compromised, which means the patient may not be breathing as well. We're also going to be checking for a narrow arch while we're in there. That could be a sign that there may not be enough room for the tongue, which could cause the tongue to block the airway. We're then going to start checking the soft tissues. Have the patient open and relax. We're going to check for the tongue level. If the tongue is above the occlusion plane, that could be a sign of an obstruction. We're then going to check the Malampati class. Have the patient stick their tongue out. See how much of the oropharynx you can see. If it's very little, that can be a sign of obstruction. While the patient has their tongue sticking out, we're also going to check for a scalloped tongue. That could be a sign of the patient pushing their tongue forward to remove the obstruction so they can be able to breathe. Now we're going to check the oropharynx. Hold the patient's tongue down using a mirror. We're going to check the soft palate for any signs of redness or inflammation. We're going to check the tonsil size and grade. Do the tonsils sit within the tonsillar pillars? Are they in line with, or are they outside of? And that can be a sign of an obstruction if they are. We're going to look at the size of the uvula. If the uvula is elongated, that can be a sign that the patient's been having trouble breathing. While we're checking for signs of bruxism, also check the cheeks for signs of linea alba. That can be an indication that the patient is currently bruxing. Also, while we're checking for signs of bruxism, we're going to check the patient's occlusion class. A posterior crossbite can be a sign that the maxillary arch is too narrow. So as you can see, the screening for obstructive sleep apnea takes no longer than your standard oral cancer screening that you're already doing. You're just looking at things differently. Where do we go from here? The next thing I would do is start with my patient's cleaning. During that cleaning, I would pose the question of, has anyone ever told you that you snore? And if the patient's answer is yes, we can let them know that we're going to mention it to the doctor and find out where to go from here. At that point, we can determine whether to refer the patient to their primary care physician, to refer them to a sleep specialist.